Hi, my name's Karina and I'm a registered nurse case manager. I have done 2 in-services for my unit on the implementation of an improved social determinants of health assessment and interventions for congestive heart failure patients. My project was to design, implement, and evaluate an improved social determinants of health evaluation and implementation plan for patients with congestive heart failure. This was to improve case management and nursing competency, documentation, and patient outcomes in the transition from a facility to a community setting. In my current role as a case manager, I often see patients with CHF readmitted due to the inability to get their medication, lack of understanding or education, and lack of overall community support when there were clear, identifiable social determinants of health, either identified and not addressed or never even assessed. This poses an issue with healthcare equity. According to White Williams et al., 2020, social determinants of health have a direct relationship with patient outcomes and risk of readmissions, especially in patients with CHF. Social determinants of health refer to conditions or situations in one's environment that affect one's ability to function and live, to include things such as income, education level, transportation, food, housing, and financial security. These factors are influential in one's level of health and availability to equitably accessible healthcare. So when I reviewed the current policy for assessing social determinants of health, there was limited assessment. I then interviewed current staff members to inquire about their confidence in assessing social determinants of health, as well as what to do with the information obtained. The interviewed staff members all stated that they either didn't know where to find the assessment, didn't know what to do with the information obtained, didn't understand what had to be done within their hospital stay, and some did not understand what social determinants of health even were. From these interviews, I then created my purpose of educating nurses on social determinants of health, what it entails, and how it affects patients, and specifically patients with congestive heart failure. I knew I would need to implement a resource for nurses to refer back to, as well as to share with peers to best implement this plan. I got to work by creating a book that contained new and enhanced social determinants of health with clear direction on what to do with the information. Pages were made for community resources and organized by topic. With the assistance of my mentor, I created a lesson plan with clear and measurable goals to evaluate the conclusion of the in-service. By the end of this lesson, the learners will be able to teach back an effective social determinants of health assessment for congestive heart failure patients, responsive interventions, and explain the importance of thorough social determinants of health assessment to prevent readmissions and improve patient outcomes. To measure the effectiveness, I issued a quiz at the conclusion of the session and obtained feedback from both my mentor and those in attendance. Through an extensive literature review, I identified the key questions to ask when it comes specifically to patients with congestive heart failure. According to Browder and Rosamond, 2023, patients with low socioeconomic status are statistically shown to have a higher 30-day readmission rate and more frequent exacerbation symptoms when compared to those as identified as not being in lower socioeconomic status. Proper assessment and then connection to community resources is crucial to improve patient outcomes. By clicking on this link, you'll be able to see the social determinants of health assessment that I created. As you can see here, I have the new and enhanced questions with clear direction on what to do if they answered yes and if they answered no. If they answered no for a lot of them, then it was highlighted in yellow, as opposed to yellow highlighted if it was yes, meaning they were both identified as an issue. From that, they were told what they could do, what resource they could access. Through an evidence-based peer review, literature review, consultation with my mentor, and review of community resources, I created a resource document for financial insecurity, food insecurity, housing insecurity, and transportation insecurity to hand out at the in-service, and a binder to place on the units so that the nurses had the access to the resources to provide to patients based on the assessment. By clicking this link, you're able to see the resource for patients identifying as needing financial security. As you can see, there are several topics within this resource for financial insecurities. At the conclusion of the in-service, peer feedback was positive, with participants stating they learned something new and were thankful for the new assessment. With prompts on what to do with the information, as well as the resources to provide, they felt a lot more confident. A quiz was issued to measure the effectiveness of the session and resulted in an average score of 95.3%. Overall, my goal was to empower nurses, make a small imprint in closing the healthcare inequity gap, and improve CHF patients' outcomes by reducing the frequency of exacerbations of symptoms and preventable readmissions within the hospital. If you click on the link here, you'll be able to see the quiz that I issued. Through this project, I learned a lot about social determinants of health, the impact on patients with CHF, as well as any patient, and that there is always new and updated information, so it is critical to continue to research, learn, share knowledge, and be open to learning change. Thank you so much.